But alongside the 100 million doses in 100 days, President Biden also said he wanted all elementary schools reopened in his first 100 days. And the CDC has put out guidance about what it takes to safely reopen schools. Most schools, honestly, don't yet meet that criteria. And there's a lot of concern as to what it's going to take to get schools to a point where they do meet that criteria. The money in the COVID relief bill that's for reopening schools safely, that will help, but that too is a ways off. It hasn't even passed the Senate yet. So teachers and school staff in particular have been really worried about what it means to have all this new pressure to open schools, especially to open elementary schools and to open them quickly, which everybody agrees is an important goal and is really important for kids. But it's unnerving to have that sense of pressure and that sense of imminent, potentially forced reopenings, while so many of the adults who make schools run still themselves can't get vaccinated. Well, here's the other big news today. Here's what President Biden said about that.
Over 30 states have already taken the step to prioritize educators for vaccination. And today, I'm using the full authority of the federal government. I'm directing every state to do the same. My challenge to all states, territories, and the District of Columbia is this. We want every educator, school staff member, child care worker to receive at least one shot by the end of the month of March. To help make this happen, starting next week and for the month of March, we'll be using our federal pharmacy program to prioritize the vaccination of pre-K through 12 educators and staff and child care workers. Throughout March, they will be able to sign up for an appointment at a pharmacy near them.
They'll be able to sign up for an appointment at a pharmacy near them. Prioritize the vaccination of pre-K through 12. So pre-K through elementary school, middle school, high school educators and staff, plus child care workers. What is the federal pharmacy program and how is this going to work? I mean, getting every teacher and school staff member, every child care worker in the country vaccinated this month. This month. He wants this done by the end of March. He wants them to all have at least one vaccination shot by the end of this month, by this new initiative from the federal government. That would be absolutely huge. How is that going to work exactly? Joining us now for the interview is Dr. David Kessler. He is the Chief Science Officer for COVID-19 response under President Biden. And sir, it's an honor to have your time tonight. Thank you so much for being here.
It's a pleasure to be with you, Rachel.
First, let me give you a chance to correct me if I explained any of these new policy announcements or the new place that we are with vaccines in a way that was wrong or that missed the point at all.
No, you got it exactly right. In 3 months, we will have enough vaccine for every adult in this country.
When you think about the match of the need to the resources, this is obviously a huge piece of it. Will there be enough actual vaccine, actual fluid in vials to vaccinate every adult in the country? Knowing that is now going to happen by the end of May rather than by the end of July, which was the already ambitious goal that you had announced, that's a huge piece of it. The other part of matching the resources to the needs, though, is the distribution. And we've all experienced, my family has experienced it 1,000 times over, the difficulty and the complexity in trying to get people matched up with vaccines that they need, try to get those appointments, try to get people in line. Is our distribution effort going to expand to meet the need in the way that the production of vaccine is?
Exactly. Right now we have many of our state and local partners administering vaccines, but we will add and are adding every week not only increased number of vaccinators, but increased number of sites. We're doing that at mass vaccination centers, mid-sized vaccination centers, community health centers. As you mentioned, there will be a federal pharmacy program for teachers, among others. So there are a number of increasing distribution channels that will keep up with this increased supply of vaccine.
I'm not sure that I understand what a federal pharmacy program is and how that will work for the teachers and school staff members and childcare workers and all their families who are watching this tonight, trying to figure out what this means about their loved one or themselves being able to get the vaccine by the end of this month. How does a federal pharmacy program work?
Well, let me make it simple. Beginning the week of March 8th, go to the CDC website. If you're a teacher, you will see the participating pharmacies in your neighborhood that you can go to their webpage. And if you're a teacher, if you're a child care worker, if you're a staff worker, if you're a bus driver in a school, you are eligible to go to that pharmacy and get your vaccine. And we want all teachers to have at least one vaccination the month of March.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.